in our little ghetto. Rambling going on, let's protest. Children of peace. Breaking out the control, world on fire, earth on fire, fire burning, hoping and praying for things to get better. But Rasta now, it gonna get worse. So much worse. Signs of third times are getting clearer.
Well, my salon people, and today we're there again as we get an intro of Joe Hills. Well, today we don't go to the health sector. This is not TBS online radio where we all know say today na the 30th of September 2023. Today we decide, as we all know, the TBS online radio we actually try for make sure say we reach with people them in terms of health, good health, well body and all that thing and day. Well, we don't decide say we get for the run health issues them, health programs in we medium. And we get boku doctor then our platforms them. We get boku medical practitioners in our platforms them. Well, we don't get some medical practitioners where they don't come together that then get for every Friday then get for go to talk to we on certain health issues. The first one where they don't start with now on diabetes. They don't make we for understanding na two type of diabetes now they will get. And but when you listen to this presentation here, when me fumble them, you say will know the type of diabetes then where we get. Do ya continue for stay with we. This na TBS online radio. Me na yours truly, Mr. Tuboku Mexke. This program today are dedicated to all my salon people that are at home and abroad because diabetes is real. Diabetes, they kill people them every now and then. So me family, let we pay attention. This na health matters, na health issues this. So me family them, no sit down and relax and forget what you say for health is wealth. Yeah, this na team up for salon. Now your good governance program, but today we decide for future health issues. Now that make we invite we brothers and sisters, and today now we platforms them way before say well done then at the diaspora they don't know a lot of health issues, so then can share with we today their experiences and expertise. We main presenter when Mr. Almami Mansare, you know, Ingo can actually do the presentation on behalf of his colleagues them. And this na TBS, Tuboku Broadcasting Services, and we always there for giving the best. No hesitate for subscribe to this YouTube channel. Always now your channel is to say they get waiting you always want forget. And all the news them on health issues we get for the cantona on issues that were not all the health issues, even on business setup, business startup, business economic issues, you know, water issues and environmental issues. We get for they can talk to we people them. All right. So time to time we get for the get practitioners and experts and work for they can do presentation. Me na Mr. Tuboku Mexke, well na the proprietor for the Tuboku Broadcasting Services when an online radio program and online television. So ladies and gentlemen, sit tight and listen to we able brother when a medical practitioner whether in the US and you can give we inside and take on diabetes. God bless you and have a blessed stay. No hesitate for reach win a +232 76 17 3186. At any time you want reach we want be part of our platforms them. Now that number they call we or you send we message. We go add in our platforms and they go benefit all them thing they will they post on our platforms. We'll get baku good things in for una. But again, don't hesitate. Subscribe. Click your like button so you will always be notified whenever I do a fresh and new publications. God bless.
Okay, Tuboku Mexiga for we'll be decide say today we will give a small health talk. We want to start with diabetes. Again, Auntie Raslin, Auntie Selena, they all they are medical personnel them. We don't talk now the admin forum, then go come in and give them your little response. I will make the audio short for people in a salon for benefits from them because the data issue. When we talk about diabetes, let's put them in the simplest way first. Too much food, little insulin. What do I mean? Anything what we eat, now we body, we digest them. It turn to glucose. Now that glucose, the blood they absorb, send them various side for make we get energy. One of the fuel what we body need for all we do, all we perform, all we activities them. But with that same glucose day, one of the fuel, if it boku, it become diabetes, it cause diabetes. Now in the issue we can talk about diabetes. So diabetes, we get type 1 diabetes, we get type 2 diabetes. So Lord, we understand that day. We get type 1, we get type 2. So I will start for talk about type 1 diabetes first. What's in a type 1 diabetes? Type 1 diabetes na sickness we call autoimmune, meaning nothing not the cause them. We cells then at the body can attack themselves. Now, like when you get salon soldier to salon soldier, fight themselves, wouldn't they defend salon or then begin attack themselves? Now, so type 1 diabetes, your immune system, they attack one another cells. The beta cells then are the pancreas, when are then responsible for producing insulin. Type 1, they attack them, it destroy them cells, then they will not be able to produce insulin again. Type 2 diabetes, my inner the diabetes will be say the person they produce insulin, but the insulin not enough for cover the food with that person they don't eat. And type 2 diabetes can be genetic, and it can be people of black color. We are more prone to type 2 diabetes. It can be say it is genetic, it is a family line. Your papa don't get them, your mama get them, it pass on that family day. So now that's not type 1 and type 2. So in simple understanding, type 1, no insulin, the pancreas not they produce. Type 2, the pancreas they produce insulin, but it's not enough. So now, just like what I say earlier, we can talk now about the things them where we need to understand about diabetes. Okay, so I start with type 1. So the type 1, just like what we say earlier on just now, the person in pancreas, when one of the endocrine system where is supposed to produce insulin, that endocrine system they not they produce the insulin. So as a result of that endocrine system, they not they produce this insulin. Where that person they eat, the blood glucose they go up. So where that blood glucose they go up, it's very, very, very dangerous. Because that person then they feel like in body they become tired because you not get insulin for good level. That food day where the person don't eat insulin all day for go normalizer. The person they become tired, they feel weak, in body they warm, they begin sweat. So once you begin notice then signs, then you get for begin to say, oh, my sugar they go up, my pancreas not they produce insulin. I need for go see somebody when a medical doctor or health practitioner for help with them things then they. Okay, so once you begin feel that kind of way then the way you don't eat, these are signs of you having type 1 diabetes. So now, let we go briefly for talk about the type 2 diabetes where we say the person they produce insulin, but the insulin not they be enough for cover the food where that person they don't eat. So now that we call type 2 diabetes where be say mostly it can be genetic. Maybe your papa been get I pass it on to you, especially people that we get boku weight, then fat people then can prone to type 2 diabetes, especially we black people we prone more to type 2 diabetes again. So once that don't happen to you, now you they eat, but you they produce insulin, but that insulin the way they produce, it not be enough for cover that food. you see if they begin develop then signs of hyperglycemic. What's in hyperglycemic? The sugar in your body is too much, the insulin not do for cover that sugar there. You will begin sweat. Some people like they begin shake, they sweat, they shake. Some people can confuse. You can see most of them people and they piss fast. Sometimes before you do clean, don't piss 3, 4, 5, 10 a net. These are all signs of telling you now, telling you that you are diabetic, especially if you wake na net, they piss then 3, 4, 10. It's not normal. These are most of the time diabetic people and can get that thing there. And diabetic people then can get this thing outside and they feel thirsty fast. Then they drink no more than they drink. Then they eat no more than they eat because the food when they eat, wait for go give them energy. That glucose they not able to go give them the energy because the glucose just did the insulin not there for making normal. Allow we get a homeostasis, equal insulin, equal food, there. So as a result, they feel tired. You go feel say na eat, eat. You just go to eat and they eat. Now so they gain weight. As they gain weight, now so they become more diabetic. So once you begin see the signs, then and one early signs especially for man them, your sexual potency they begin go down because the veins for make you able to get an erection, the heart for beat fast. When the heart beat fast, it send blood now all the vein them. And when it send blood now all the vein them, it cause erection. So once you get diabetic, you become diabetic, the sugar don't bokupa you. It begin slow down your erection. It begin slow them down. These are another signs. When you notice that, go see a doctor, discuss with your healthcare professional, then be able to try for know exactly what's in the go on with you. In continuation to that again, we get how we able to diagnose diabetes. We get what called fasting blood glucose. Where we say where you go sleep na net, na fast you the fast because they eat anything. Where you wake morning 10, we want a normal blood sugar for them between 70 to 100. Some doctor then can go to 110. We want a normal blood glucose sugar in the morning for make it them. So if you see that sugar where you wake morning, it's nothing. That sugar pass them 100, 110, 120. You go in and call pre-diabetic, meaning you don't begin show signs say you're diabetic. If you see go 125, you don't become diabetic. That's meaning you need either for begin take diabetic medicine them for equalize your sugar, or you need for begin get insulin, or then they choke by you insulin, or they go na the belly, or they survive na the belly. And I make it you can either choke under your bottom belly, na the arm, na the leg, na the back, any side where you want to feel comfortable. As you eat to give you insulin, for normalize that. So now what's in the happen? When you go sleep na net na fast to the fast. The liver is supposed to produce glucose for the brain function because we sometimes nothing in the belly they sleep. But you need energy for making all left pan sleep. And because you need that energy there for making all left pan sleep, the liver they produce that glucose there for you. For some people the liver they produce beaucoup glucose, we can make them they become type 2 diabetic. So now Imeku can tell them fasting blood glucose in the morning, not eat anything, nothing. First thing in the morning, come to the doctor, we draw the blood by you, we call that test the hemoglobin A1C test for make we able get the blood and see what's in the sugar level by you. So now, the dangers of diabetes, I want to make we talk about, let everybody understand and see how dangerous diabetes is. We get beaucoup type of diabetes and beaucoup effect the way diabetes they cause. Diabetes they cause blindness. Diabetes they damage your kidney, especially coupled up with high blood pressure. Diabetes can lead to them cutty foot. Diabetes they lead to all them dangerous things then they. So now that make na sick. People and see them like it's small and funny, but diabetes is not so small and funny sick. How diabetes they cause blindness? We get and call retinopathy, diabetes retinopathy. We get the retina, we now one of the main vein we come up from the brain to the eye. If you are diabetic, then vein then the too much glucose, they corrode them, it destroy them. So that brain now, from the brain to the eye, not able to send signal again. It make you become blind. So this is now one of the dangers of diabetes. The second one again, we get what called diabetes neuropathy, where all the veins stay way in your foot, where the blood for flow back and forth. Diabetes, they make them veins, then they narrow, they constrict them veins, then they all the other veins, then they constrict them, and as it constricts them, it begins slow the blood flow na your foot. They go there penalties until begin feel one two. They scratch your foot, they scratch, they numb. Sometimes they pana you begin see one two die. You get small sudden, now that sudden not the well again. You go there and say pass them cut your foot. Now diabetes can cause that. They see some man get so foot, this so foot's not well. They don't mean and say, but most of the people let them who know what they can say, this now which man and they pan and so this soil don't take pan this person. Diabetes, they make somebody in so not the well. Now make even if you diabetic, you go to hospital, the first thing they do your blood glucose. No matter how emergency operation you need, we know they do ampire until we stabilize the blood glucose before we do that surgery for you. Because if we do ampire, that's so food they not the well. That's so food they not the well. You know the well today, not the well tomorrow. So these are some of the dangers of diabetes. Then diabetes, they damage the kidney. We now one of the most dangerous thing where people really need for watch out for that when you become diabetic. One of the dangerous things the way for watch out for diabetics, they pack the kidney. When you get too much sugar in your body, now the kidney get for work over time, extra time for compensate for get rid of that too much sugar there. Just like what I talk just now, I say with somebody diabetic, it piss beaucoup, the kidney, they try for get rid of that excess glucose there. The kidney no want under the system, and the kidney na in the shifter, na in the reabsorb what in the body want to take her, what in the body no want to excrete them for go piece. And so now that kidney they get for work over time. They get for work. By the time you know it affects your kidneys them. It affects all the nephrons them within the kidney, then the small veins the way connect now the kidney them, it affects them, it pack the kidney then, now your kidney they no work, now you need dialysis, your foot then begin swell, your face begin swell. These are all the dangers with diabetes they cause. So what do you need for do? If you don't notice some of the things that we don't talk about, you they notice your hand and they numb, your foot then they scratch, you they piss too much. Sometimes your body just they feel warmness, you they feel confused, just know say go see a doctor, go see your healthcare practitioner, make them do test by you, check your sugar, make them start for see whether na your sugar na in too much, or we call hyperglycemic. If na in too much, the doctor get for try for tell you say you need for manage this sugar. Then get for begin teach you how to manage your sugar. Because unmanaged diabetes, a very dangerous past HIV and AIDS. For managed diabetes, a very dangerous past HIV and AIDS. Because with HIV and AIDS, all what you need now for take your medicine there, how them prescribe them for you consistently, they take them till you lower the virus level. If you take your medicine and then detect an early, time reach safe now. If you do my man that business, you're not able to transfer the HIV because you don't put the viral load so low that person not able to get again through sex. But with diabetes, it had for manage because it involves a lifestyle change. It involves a lifestyle change. You get for try for the exercise regular. You get for watch your diet, most of them carbohydrates them, then white rice. You get for avoid them. It's more of grains. You get for eat more of grains, bulgur, funde. The hyperglycemic index of them food then they is very low. What's in the hyperglycemic index? The moment you eat rice for make it digest and send that sugar, now in the hyperglycemic index. So their food then they digest very slowly. And because they digest very slowly, then become friendly foods for people and with diabetic. So we get for watch we diet. We get for watch we weight. We get for exercise. Not to all tea they eat again. Try for eat things then now where you know say very, 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 very healthy and cut off a lot of them things then they for manage your diabetes. If you become unmanaged, it's a very, very dangerous system, especially for we black people. We get high cholesterol, when are one of a very dangerous issue. We get high blood pressure. If you see you now, you go mix them with diabetes, then comorbidity, then they all you make them, my brother. Now go they go before you time, so now you grave. But a lot of people in the die in Sierra Leone because of diabetes, but they don't know. Just like what I say, some man go get so you know they well because that person they diabetic, he get too much sugar. That's so no matter what you do, it not go well. The other thing again, with this blood sugar, we get what them call high blood sugar, we get what them call low blood sugar. Low blood sugar is very, very dangerous. Sometimes when your sugar low to very dangerous extent, below 70s, anything below 70, very dangerous. Some people it can go into coma, then can even die. Because the sugar we for send that energy we for send for make the brain function in all day. So when them people in them blood sugar can very, very low, what think can happen? The heart rate it beat fast because the heart defect for compensate. We call them tachycardia, where the heart they beat fast. That's a sign. You can see some of them, they can feel confused. Then they anxious no more. Yeah, despite too anxious, wait. No, you can see that they feel confused. Some man they sweat. Then can become in they like when they say the tornado can depend we say medically dizziness. Tornado can depend, then can feel angry. They want for it every minute. So once you begin notice, then things then they just know say you need for say a healthcare provider. So then go check you for know exactly what's in the go on with your sugar. Okay. So what are the dangers them of type 2 diabetes, just like what I say earlier? If you get diabetes, they're not managing well. For make you get heart disease, a very, 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 very quick for make you develop heart disease. And once you develop them problem, then it increase the risk for make you get a stroke. Or they say somebody don't paralyze. It increase the risk. And diabetes and that high cholesterol, we they call atherosclerosis medically. What thing they happen with and you vein them. When are they the blood for pass? And the blood where they pass, not the blood no more they pass at all. The blood they pass with oxygen where they supply the brain for make you they alive. Because what thing they happen, the blood will not get oxygen where they come on the brain, where they can at the lungs. It can't take oxygen at the lungs. It use the left side, it go up back na the brain for go supply that oxygen there to the brain. So once you diabetic, you get the potential for develop what we call atherosclerosis, where your veins then they constrict. The amount of blood, oxygen, and nutrients where they pass na that brain, there na them veins, then they don't small, they don't constrict. So by the time you know it, you're not able to supply the right amount of oxygen where the brain need. And by the time you know it, you don't get stroke. And once you get stroke, it's all depends. If you get stroke, now you attack the left side of the brain, the entire right side na your body, both upper extremity and lower extremities, they die. So that na the danger. You get for watch that seriously, just like what I talked earlier, diabetic neuropathy, it damage the nerve them. Within your lower extremities, it damage the nerve then. The way it damage there now, you they begin feel complications there, like you hand in your foot then they tingle, then they burn, you they feel pain, sometimes numbness, then can begin force now the tips of the toes them before they remember the hand then the foot them is spread all over. That now one danger. These are the complications them where diabetes they come with. The kidney, where see damage and pass, you end up on dialysis. And like for Sierra Leone, we not to get dialysis machine then they where see don't damage the kidney, they're not able to give transplant. Na Tiwo not able to reverse again. So a fine for make we dey watch what we dey eat, Lord, we dey exercise, and Lord, we pay attention to we health. Okay. So in addition, what are the signs and symptoms them we for look for no say we blood sugar is high. Just like what I say, you mouth the dry, you dey feel for drink fast. Anytime you see you mouth the dry, you dey feel for drink fast. It's not an ordinary situation. Most of the time, then people and their sugar is high. Just the need for peace fast. Sometimes when they sit down, they talk before you remember this person don't grab it, don't go peace 2, 3, 4, 10. They wake na net, they peace then 2, 10, 3, 10. Just know say your sugar is high. The kidney they work over time for get rid of that sugar. They can get blood vision. At times they see you look normal, you see like molecules then in your face, they see fine. Those are all things you need to know say you are diabetic. You dey lose weight. Weight be say not till you plan for lose that weight there, but you wait till they lose a normal. That for tell you say you diabetic. Some people like they see then they get a skin rash pan them, then they get recurrent infections them. That's not for tell you say your blood sugar is very high. So you really need for see somebody will go help you with that.
Doc, thank you so much. The information always don't send is very good. Thank you so much. Yeah, but me, I get one question I want to ask you. Yeah, because I'm doing a job now. There was this person one minute neighbor he suffer from this diabetes here. We did talk about so. But being an African, me mama say get her. My mama they na mango leaf they drink. Where they think you want come up? He okay. So I tell this Brazilian, I see they boil mango leaf, they drink. They drink them, they think calm down, but we go to hospital, now the doctor asks her, what you take? Now he say na mango leaf. Now the doctor tell her say, he say they left, he said not that, he get water in blood. So I don't know if I can recommend herbal tea for diabetes. Thank you.
Thank you very much, my brother from Brazil, for your question. In Sierra Leone, don't you hear that? Say mango leaf, they help for lower the blood sugar. Well, I haven't tried it. We in the medical field now something where has been tested on evidence base. Now we they go by. But if them people like how you say work for you, mama, well and good. Who is me to say make you not use them? If you work for them, fine. But what me they tell you, let them go do test. The human being system is very complex. Now hospital self, you can see where somebody sick, they go to hospital, they mark something a one green sick you get, but they mark maybe 4, 5 medications then for that person. You know why? Because when you take one medication, they go cause that effect. So now make we can mix the medication there. So the other medication they go counter the other effects. The other medication counter the other effects for help for stabilize the system. So possibly the mango leaf they work, but it counter another system na the body we need another medication for work. So now that can make you see with they combined the medications them. It's just like if somebody gets an infection, it can't meet to a kind of hospital. We can write a prescription for 2, 3, maybe 2 different antibiotics them. You know why? Sometimes the one antibiotic they kill the virus. The other we call bactericidal. The one antibiotic it help for suppress the virus, make it not grow, or called bacteriostatic. Then again, some of the antibiotic here, they give them, pass to give probiotic, because even the antibiotic they give, it go destroy other things then at the body, what the body need, it wash everything come on. So pass can give you, especially them broad spectrum antibiotic there, pass can give you probiotic them for help for restore the damage with the antibiotic they cause now the system. So now that make we can always see a doctor. So possibly you're right, I don't know, but all I'm telling you, yes, it might work. I don't know about that. I'm more focused on English medicine. Yeah, but Alan, I think we don't answer Aziz in question. Everybody can ask a question we didn't get now. Yeah, they can ask. Yeah, brother Alan, in the area of the food where people for eat, we very good for diabetic people. One thing, first of all, I go tell you say avoid carbohydrates. Then starchy food them. We get too much carbohydrates like that white rice. Now for avoid them. Anything we get too much carbohydrates. We know the carbohydrate food then as alone. Now for avoid them. Then secondly, I go recommend, of course, sugar. Stay away from sugar. I go recommend for make people in the eat food them way low in glycemic index. Waiting at the glycemic index now food the way no they digest quick na the belly, then they digest very slow, and the more they digest slow, the more they release less glucose na the body, like bulgur, funde. Then we green food them, kobo, jakato, mix them things then they. That not a cure the diabetes, but it a help for manage them. You ask a question, say how for flush diabetes na your system. Well, let I just explain this again. We get two types of diabetes. We get type 1 diabetes, when na autoimmune disease, the pancreas no dey produce no insulin again. The beta cells then are the pancreas, then they produce insulin. We see you don't get type 1. When I go manage a normal, you become insulin dependent na your life now till you die. Type 2, now irreversible. Type 2 diabetes, especially if they notice I'm early, you are pre-diabetic, you work on your weight, you lose weight, you work on and lose your weight. Once you're able to lose your weight, you get a very healthy weight where your BMI become normal, you exercise on a regular basis, you look what you eat, you cut off them carbohydrate food them, you give yourself what and call downtime where you eat now, you wait for long period before you eat, and you eat a very healthy food where you right, you're able for reverse type 2. But type 1, you cannot reverse it. But type 2, you're able for reverse them. But even when you reverse them, you just start like where you and lose weight. You go able to work hard, you lose weight, you normally weight. But if you go back to the things that way you they eat, you gain weight back. No, so if you go back to that same lifestyle where you been there, you not change them. There is possibility the type 2 they come back. So type 2 is reversible, type 2 is manageable, type 1 is not reversible, type 1 is manageable. What we call manageable? It means you're not able to reverse again, we just they manage and now make it not cause damage by your system. Now so they manage them now. Yeah, brother Alan, in the area of the food where people for eat, we very good for diabetic people. One thing, first of all, I go tell you say avoid carbohydrates. Then starchy food them. We get too much carbohydrates like that white rice. Now for avoid them. Anything we get too much carbohydrates. We know the carbohydrate food then as alone. Now for avoid them. Then secondly, I go recommend, of course, sugar. Stay away from sugar. I go recommend for make people in the eat food them way low in glycemic index. Waiting at the glycemic index now food the way no they digest quick na the belly, then they digest very slow, and the more they digest slow, the more they release less glucose na the body, like bulgur, funde. Then we green food them, kobo, jakato, mix them things then they. That not a cure the diabetes, but it a help for manage them. You ask a question, say how for flush diabetes na your system. Well, let I just explain this again. We get two types of diabetes. We get type 1 diabetes, when na autoimmune disease, the pancreas no they produce no insulin again. The beta cells then are the pancreas, then they produce insulin. We see you don't get type 1. When I go manage a normal, you become insulin dependent na your life now till you die. Type 2, Now, irreversible type 2 diabetes, especially if they notice I'm early, you are pre-diabetic, you work on your weight, you lose weight, you work on and lose your weight. Once you're able to lose your weight, you get a very healthy weight where your BMI become normal, you exercise on a regular basis, you look what you they eat, you cut off them carbohydrate food them, you give yourself what and call downtime where you eat now, you wait for long period before you eat, and you eat a very healthy food where you right, you're able for reverse type 2. But type 1, you cannot reverse it. But type 2, you're able for reverse them. But even when you reverse them, you just start like where you and lose weight. You go able to work hard, you lose weight, you normally weight. But if you go back to the things that way you be they eat, you they gain weight back. No, so if you go back to that same lifestyle where you been there, you not change them. There is possibility the type 2 they come back. So type 2 is reversible, type 2 is manageable, type 1 is not reversible, type 1 is manageable. What we call manageable? It means you're not able to reverse again, we just the manage and now make it not cause damage by your system. Now so they manage them now.